So it's a major, major concern in this country, and it's the most costly disease to our society right now. It exceeds cancer, it exceeds heart disease with regard to costs to society. Alzheimer's disease is biologically defined as the presence of plaques and tangles in the brain. The plaques are made of this protein called amyloid, and the tangles are made of this protein called tau. So if that's Alzheimer's disease, then the amyloid hypothesis implies that amyloid, the one protein, gets laid down in the brain, meaning it gets misprocessed in the brain, forms this sticky clump of toxic material. So the hypothesis contends that once the amyloid is misprocessed, laid down in the brain, it begins a sequence of events like the subsequent misprocessing of the tau protein, which causes the tangles, that leads to the death of nerve cells, and eventually clinical symptoms arise from that sequence of events. So amyloid misprocessing is the initiating event, and that can happen 10 to 20 years before a person becomes symptomatic. They followed the people for up to 18 months, and those individuals who received the highest dose of the drug actually had less amyloid in the brain at 18 months than they had at the beginning of the trial, and they were clinically stable, or they declined only a very little bit compared to the placebo participants who did not have any reduction in the amyloid amount in the brain, and they declined more rapidly than the people who got the high dose of the drug. It gives us a shot in the arm because there have been so many failures of major drug trials in the Alzheimer's field in the last 10 years that when we see a positive signal like this moving in the right direction clinically and biologically, it's encouraging. So with the enormous impact of Alzheimer's disease on society, on the healthcare economy, if we can make progress with regard to treatments that may reduce the number of people with the disease, delay the onset, slow the progression of the disease, that would be huge for individuals, families, and the healthcare systems. So there is a fair amount of evidence that exercise, aerobic exercise, maybe some resistance training as well, can actually slow the progression or delay the onset of clinical symptoms. We recommend that people stay intellectually active, stay involved in their social networks, and from a dietary perspective, I don't think there's any magic there, but perhaps a heart-healthy diet, a Mediterranean diet, may be useful again in delaying the onset and slowing progression of the disease.